Good afternoon. I'm Jeff Birdwell, Director of the Huntsville-Madison County Emergency Management Agency. It is Wednesday, November 3rd. On behalf of Mayor Tommy Battle, Mayor Paul Finley, Commission Chairman Dale Strong, Huntsville-area government, healthcare, and our emergency response agencies, we bring you this briefing on our community's response to COVID-19. Our speakers today will be Mr. Tracy Doughty, President and Chief Operating Officer from Huntsville Hospital, and Dr. Wes Stubblefield, Pediatrician and District Medical Officer of the Northeastern District of the Alabama Department of Public Health. At this point, I'll go over the current numbers. In the state of Alabama, there are 833,493 cases of COVID-19. In Madison County, 52,817, having resulted in 712 deaths. Current positivity rate for Madison County today is 4.8%. At this point, we'll go to our first speaker, Mr. Tracy Doughty, Huntsville Hospital.
Thank you, Mr. Birdwell. Today's report is all favorable as we move forward in this pandemic. But first, I'd like to start out by thanking our healthcare workers and frontline workers for everything you've done for us over the last year and a half. We appreciate your sacrifices and the things you've done. If you look at Huntsville Hospital, we have 35 positive inpatients, 12 in the ICU, and 9 on the ventilator. That 35 pales in comparison to a few months ago where we had 220 in the hospital, so huge change over the last couple months. Age distribution, we have a neonate, mom's pregnant, mom is positive, so we presume the child to be positive until proven otherwise, and a 83-year-old are the age ranges. 20 males, 15 females. No deaths in the last 24 hours. If you look at our system, there are another 51 positive inpatients in our system across North Alabama, 18 in the ICU, and 9 on the vent. Only hospitals in double digits are Huntsville Hospital, Maine, and Decatur. Again, a good start to the holiday season as we move forward. In Crestwood, they have 3 positive inpatients, 1 in the ICU, and none on the vent. As Mr. Birdwell said earlier, we have a 4.8% positivity rate in Madison County. The state's about 4.9%, and we're at 4.3% at Huntsville Hospital. First time in months that we've all been under 5%. Another good sign as we move forward. Moving to vaccines, we're still doing vaccines at John Hunt Park at a pretty good clip, 300 or 400 per day. Mostly 90 to 95% of those are booster doses. We're seeing the first dose people numbers decline quite a bit. We want to get those back up. So if you haven't had your vaccine, please go to John Hunt Park or health department or any of our big box pharmacies, retail stores that are offering the vaccine. Please go out and get your vaccine. It's there for you. It's proven to be safe and effective. We're still doing our outdoor events. We're still doing our move around to different locations to get vaccines done in the community. This week we've been out to Tony, Airjet, Village Home Care, Madison Hospital. Next week we'll be at the ARC. We've worked with Tony McGinnis. We'll be at Todd and Johnson Towers to do booster doses for our citizens living in public housing, so we'll continue to do that as long as there's demand out there for it. As things continue to improve, we're loosening our visitation requirements for the hospital on Monday. You'll see an update on our website today or first thing tomorrow of what those will be. But as things get better, we're loosening our visitation requirements. Of course, masks will still be required, but we'll let more people in to visit and at more frequent clips, but that'll be on our website. We get a question a lot, what's next for COVID? What happens next? Everything that we read and we look at says there will be another surge at some point, so we got to protect ourselves and do those things that we know that help lessen the spread now. It's still here, so be careful. We are, I would say, social creatures by nature. We like being out and about. We like going to ball games and to movies and to live music. My wife and I are those people that like to do those things. But be safe when you do it. If you're around people that you don't know their vaccination status, wear your mask. It won't hurt you. If you're visiting your grandmother who's 89, even if you're vaccinated and she's vaccinated, wear your mask, because we all know that older people don't do as well if they get exposed and get COVID-19. Vaccines have continued to prove that they're safe and effective. 93 to 95% of people who are vaccinated don't go to the hospital or have serious issues if they go to the hospital. So please continue to do those. Booster doses, all 3 have been approved by the FDA for booster doses. Pfizer and Moderna, 6 months after your second dose, and J&J 2 months after your initial dose. So if you've already had your series done, consider your booster. Do your research, talk to your physician, but there's places in town where you can get that done. I'll close by reminding people to get their vaccine. Be safe, be careful, protect yourself and others, and don't forget your flu shot as well. And last thing, we've seen a number of people delay normal health care, mammograms, normal doctor's office visits, those things. Get those things done. We've seen a precipitous drop in our mammograms, yearly mammograms for females. That concerns us. So we're trying to get the word out to get those things done. We're open. We're doing those, so please get those things done. Thank you.
Thank you, Tracy. And now we'll go to Dr. Wes Stubblefield from the Alabama Department of Public Health.
Thank you both. A few updates from the Alabama Department of Public Health. One is that, as it's been mentioned, our cases in case rate have declined and continue to decline. The number of tests reported as positive continues to decline. Currently, we are at moderate risk for the state, although individual counties vary. Madison County is currently now at moderate. As we move forward, we will continue to see deaths reported as there are some delays. However, the hospitalizations continue to trend downward. Another update is that we would like to announce, as you've probably seen in the news, that the Pfizer vaccine is now authorized for 5 to 11. As you may know, anyone 16 and up is FDA approved for the Pfizer-BioNTech vaccine. Now from 12 to 16, there is an emergency use authorization that's been in place, and as of yesterday, it is now approved or authorized for 5 to 11 age group. I wanted to briefly mention why this is important, and then talk to parents specifically about where this can be administered. Nationwide, we've had 6.3 million cases of COVID in the pediatric age group, with around 800 deaths. In the 5 to 11 group specifically, we've had almost 2 million cases with 8,000 hospitalizations, almost 2,300 cases of multisystem inflammatory syndrome in children, and 100 deaths. In Alabama, 19% of all of our cases are pediatric, of the total cases. There have been 191 cases of the MIS-C, or the multisystem inflammatory syndrome in children. In the 5 to 11 age group makes up 8% of our cases, 1,712 hospitalizations, and unfortunately, we have had deaths in Alabama in the pediatric population due to COVID. Specifically to the vaccine, 5,000 children were included in the study looking at safety and efficacy of this vaccine. They were followed for 2 to 3 months, ages 5 to 11. The vaccine was very safe, caused minor side effects such as soreness at the injection site, fatigue, and headache as the primary side effects. There were no cases of severe COVID, no cases of MIS-C, no cases of myocarditis, no serious adverse events, and no deaths in the population group. It was proven to be 91% effective in this group, and so it is available as of today. However, the Alabama Department of Public Health will plan to have this in place by possibly early next week, although we have no specific date, those being administered at the health departments. It was reported today that both CVS and Walgreens will be taking appointments for the vaccine starting this weekend, and if you should be encouraged to go to their websites to inquire about availability. It will also be available at vaccine.gov moving forward, and on our website, although that will have to be updated on a case-by-case basis. It is anticipated that, based on projections, that every million doses given to children 5 to 11 would prevent 58,000 cases, 226 hospitalizations, and potentially 600,000 new cases over a period extending into next year. One other update is I wanted to mention there are currently no COVID-19 vaccine mandates for children in Alabama. The Alabama Department of Public Health only grants religious exemptions to children for school-based purposes, and this, as there are no mandates at this time, we are not granting religious exemptions for the COVID-19 vaccine. Thank you.
Thank you, Dr. Stubblefield. And before we go to questions, we'll take a moment and go back to Mr. Doughty from Huntsville Hospital.
Yes, sir. I'd like to mention that it was a great segue into children vaccines. So we'll be doing those at John Hunt Park as well. And we'll do those on Tuesdays and Thursdays from 2 to 6 p.m. I want to make sure that parents don't have to check children out of school and be respectful of their classroom time. So we'll do those from 2 to 6 p.m. on Tuesdays and Thursdays. As soon as we get the vaccine in hand, you'll see our website update, and you can go on and schedule your time. We'll require a parent and our legal guardian to be with the child to co-sign with them. Big brother can't bring you with the paperwork with mom's signature on it. We won't allow that. So mom or dad have to be with the child, or a legal guardian. Big brother, sister, or even grandmother can't bring you unless they're the legal guardian. So we plan to do those again. John Hunt Park, starting as soon as we get the vaccines, Tuesdays and Thursdays, 2 to 6 p.m. We'll have pediatric nurses, physician, and or nurse practitioner on site. Thank you.
And Dr. Stubblefield, you got something to add?
I wanted to speak directly to our parents out there. We know that there are some parents out there that are very anxious to receive their vaccine for their children. There are other parents who might be hesitant about what it would mean for their children to receive this vaccine. We, and I specifically, request that you talk to your healthcare provider, someone you trust, and get the information about the vaccine, about the safety and efficacy, so that you can make an informed decision for yourself and for your family. Thank you.
Thank you, Dr. Stubblefield. And thank you for watching today. Our next scheduled briefing is next Wednesday, November the 10th at noon. Until then, critical updates will be posted to the City of Huntsville's COVID-19 webpage, as well as the websites of our other partners here today. Until then, stay safe, stay separate, and remember to sanitize. At this point, we'll take questions. As always, as you come to the mic, please identify yourself and who you're affiliated with, and we'll allow one question and a follow-up.
Good afternoon, Dallas Parker with News 19. My first question is for Mr. Doughty. We just talked about, kids and vaccinations. Are we anticipating we'll need an increase in our allocation for kids as far as the vaccine doses are concerned? I know we saw, we decreased a little bit as far as what is available to us. Will we need to increase that number again? What is that going to look like?
Yes, so we ordered for our first order. They come in lots of 300, so we ordered 2,400 doses of the vaccine, and we'll do those, and we'll order additional as we see that dwindling. The states assured us that there shouldn't be any disruptions in getting vaccine as long as they're needed.
Gotcha. And honestly, I'm not sure who can answer this question, maybe Mr. or Dr. Stubblefield, but what are you hearing as far as ADPH is concerned regarding federal mandates and employers, because they're kind of caught in the middle of it all?
At this time, the Alabama Department of Public Health requests that you contact the Attorney General's office for information related to this topic.
Okay. Is that something you can answer?
Not at this time.
Okay. I'm good.
At this point, we'll end the press conference. Thank you for coming.